And
Great.
good luck tomorrow.
Thank you, Dave.
Stay cool.
We will.
All right, let's send it over to Laura.
For women dealing with breast cancer, sometimes what is needed is just a massive dose of compassion. And at the Breast Place in Charleston, they couple that with compassion and medical expertise to care for their patients. And founder Dr. Jennifer Beatty is here with us to give us more information about the Breast Place. How are you?
I'm good. How are you doing?
I'm doing well.
Good.
So you are a surgeon, correct?
Correct.
So is that something that happens right at the Breast Place, or can you give us a little bit more information on that?
I'm a breast surgeon, and what we do is we do surgery at all the local facilities. We do it at St. Francis Roper, East Cooper, and up at Trident facilities.
And you're talking about for women that have gone through breast cancer and now are looking for reconstruction or augmentation, or how does it work at your?
Both. If you are diagnosed with breast cancer at my facility or around my facility and you come to see us, we have a plastic surgeon on at the facility.
Okay.
So you will meet a plastic surgeon. I believe that every woman has a right for breast care on both sides. I believe a woman should be more beautiful or as beautiful as they were when they arrived when they're diagnosed with breast cancer at the end of their treatment.
Yeah, you just talk about a woman having the right. You also have help for the uninsured as well.
Yeah, I do provide care for the uninsured. It's a very sad situation right now. We have a lot of mammography being done for free. However, there's no follow-up for that. And so I'm working with the Barrier Island Free Medical Clinic, and we have gotten a grant from the Komen to do free biopsies in my office, ultrasounds, and taking care of these patients.
So you're saving lives for those people that really, really need it.
I'm taking care of women, and that's what it comes down to. I think when you decide that you're going to take care of people, you don't worry about the insurance part of it. You find a way to help these people, and that's what we do at the Breast Place.
Right, and you don't actually do mammograms over at the Breast Place, but you take it a step further and you actually help women understand what they're seeing, not so much just come in, get a mammogram, and then leave.
Right, and the majority of the women that show up into our office have some kind of breast complaint. They may have breast pain or breast mass or nipple drainage, or they come in with an abnormal mammogram. And so what we do, my partner Dr. Fiorini and I, we look at their films, evaluate them, call radiologists, review them with radiologists, and find out if there's something that we have to be concerned about, if there's something further that needs to be done. And if something needs to be done or just needs to be followed, we will see them as a regular basis in our office, and we can provide ultrasound and biopsy in our office also.
Okay, you have two different offices, two convenient offices.
I have a North Charleston and a Mount Pleasant location.
Okay, when we go in, do you have to have had some sort of issue? Do you have to have had breast cancer, or can you come to your facility just to get more information? Maybe give us a little bit of guidance, especially those women who are like, I've had a family history, I'm kind of scared, I don't really know what to do. At the same time, I don't want to get a mammogram every year if I'm not supposed to be.
Right, we're a high-risk breast clinic also. So what does that mean? If you have a family history, you're concerned that you have a strong risk of having breast cancer, you come to our office, we do genetic counseling, discuss that, review that, we do BRCA testing, and we just talk to people, let them know that there is hope and that it's going to be okay. I mean, there's 90% survival with breast cancer, so this is not a death sentence. This is truly an opportunity to look at life in a different manner.
But you need the information, right?
You need the information, and I recommend that all women get their mammography. I recommend they start at 35 with their first screening mammography, and then at 40 every year they should get mammograms done.
Yeah, you were saying earlier that you're starting to see it earlier and earlier, breast cancer, so maybe a woman that does have that past history, she should go in for mammograms before 35?
Be aware is what I tell people. Do breast exams, know your body. I think as a woman, we are responsible of knowing our body. If you feel a change, don't take the time and wait 2 to 3 months until your kids are out of school. Go now, and we will see you, we'll evaluate you. My job is to make you feel like it's going to be okay when you walk out my door. I will take the responsibility of that breast mass or that abnormality, and I will take care of it, so you don't have to worry about it, and you can continue your life taking care of kids, you know, raising a family, making dinners, and working. Because we don't have time to be sick, and so my job is to be the doctor to take care of that.
Well, that's wonderful. Well, thank you so very much for being with us again. Tell us where your two locations are.
I have a North Charleston office and a Mount Pleasant office. You can call us at 797-1941, and we'll get you in right away. We can usually get people seen that day or the next day.
Fantastic. Well, Dr. Beatty, always good to see you. Thank you so much for coming.
Thank you.
All right, we're back with more Low Country Live coming up after the break. Stay with us.